Thank you, Mr. Chairman, and certainly thank you to the members of the committee for considering the Main Street Pharmacy Access Act, formerly known as ECAPS. I'd like to give special thanks to my colleague Brad Schneider from Illinois, who has been great to work with on this bill. Across Nebraska and throughout rural America, access to health care can be a challenge. By nature of living in a rural area, oftentimes patients must drive significant distances to receive the care they need. The long drive can be a significant obstacle to receiving care in a timely manner, especially for seniors. It can be the reason someone delays, for example, getting a flu test. If they do have the flu, that delay can lead to the illness progressing and a late start on treatment. I mention seniors because despite private insurance and Medicaid providing coverage, Medicare does not provide reimbursement to pharmacists for testing and treating common respiratory illnesses. A person could go their whole life getting tested for the flu by their community pharmacist, but the day this person turns 65 and enrolls in Medicare, the community pharmacist no longer offers them the same service because Medicare doesn't pay for it. In turn, the senior now may have to drive several towns over to get a flu test. Pharmacists are among the most accessible healthcare professionals in the country. Roughly 9 in 10 Americans live within 5 miles of a pharmacy. Pharmacists play an important role in filling healthcare gaps, particularly in rural areas, and this role shouldn't end when a person turns 65. The Main Street Pharmacy Access Act takes a practical, targeted approach to addressing this gap for seniors. Our legislation allows Medicare to reimburse pharmacists for testing and treating common respiratory illnesses. Importantly, this bill doesn't touch scope of practice. It totally defers to states, and states will continue to determine what pharmacists are permitted to do. But in states where pharmacists are allowed to test and treat common respiratory illnesses, this bill allows Medicare to cover it, just like private insurance and Medicaid already do. This bill is about access. This is about making life easier for Medicare beneficiaries, both rural and urban. Improving access to basic testing and treatment can help patients receive care earlier and reduce unnecessary emergency room visits. I appreciate the broad bipartisan and stakeholder support this legislation has received from pharmacists, along with patient advocates and rural health organizations. I thank my colleagues who have worked collaboratively on this issue with me, and I urge members to support the bill. Thank you.